This side.
Because in this medial part, the nerves and arteries mainly in the superficial region compared to the lateral region.
And here, arteries and nerves located
more deeply.
more deeply.
Between the second and third, first and second.
Really? Arteria radialis and nerve radialis located just really superficial here. You can palpate it. You can press this structure if you have a bleeding. And as you said, that artery ulnaris and nerve ulnaris, between which layers it's located on antebrachium? Artery and ulnar nerve. In the distal part of the antebrachium, where is it located?
Between second and third.
Second and third muscle layers. Right, we have 4 of them. You make an incision in a correct side. You start. So, what did you do? You first
find the bone on this about.
So you first find
stellate
processes. After that, 2 centimeters above. Make an incision. The length of incision. The length of incision.
4 centimeter.
More.
8 centimeter.
8 centimeters. 8 centimeters. Okay, 8 centimeters incision. After that, you take this instrument and you palp the ulnar bone, moving just near the bone, because the artery and the nerve located in the second, between the second and the third layers, and you moving just on between the third and the fourth, because the pyragopparona space located between these layers, between the third and the fourth one. You moving here. After that, when you feel that it's enough, that you feel, then you touch the skin. You open the instrument, make an incision. Take what?
Lancet.
No. You make an incision with a lancet, with the scalpel. And after that, what do you need to do after you open the space? Here we have a pyogenic process. Yes.
Then we have to use the aspiration, and we have to take on the
aspirators, one variant. What else?
Retractors.
No. Imagine you aspirate all the liquid, but you haven't got any how to say it, sure that that's enough. Pyogenic infection can continue.
we have to clean.
You put drain. Correct, absolutely correct. In this situation, you will use for a drain a cotton, the length of cotton, the length of gauze, and a rubber. This is a special drain for this space. In my practice, we usually left there a tube with a hole. So you can use this tube. You can put a liquid into it. But our professor will ask you about a gauze and a rubber. You catch them and move back. This is the operation to drainage a pyragopparona space. The border of this space.
Border. In the back side, there is interosseous space and quadratus pronator.
Not interosseous space, but membrana interossia.
Membrana interossia and teres quadratus muscle.
Quadratus pronator. Okay, middle.
And in the medium, fascia, forearm.
Proper fascia.
Fascia of the forearm.
Okay.
And in
Lateral.
the lateral, interosseous septa of the brachioradialis.
Which one? Anterior, posterior?
Anterior.
Anterior, correct. Upper.
And upper part, flexor carpi
Profundus. Digitorum profundus.
Digitorum.
Digitorum profundus.
Profundus.
Palmaris.
Flexor carpi palmaris.
Not palmar. Pollicis longus.
This is longus.
Because palmar is located in a superficial layer.
Yes.
Okay, here.
Here,
The
Top.
top, yeah.
the tendons.
Flexor.
Of flexor
Profundus.
pollicis.
Digitorum.
Long
Longus.
flexor digitorum and
Profundus.
profundus. And here,
The bones of carpal bones.
we have a canalis here.
Flexor retinaculum.
No, flexor retinaculum. Just,
Upper.
better say, how to say it? Surround
From
the
here there
canalis.
is connection through the canalis.
The connection. With which structure? With which spaces?
Canalis carpalis through to the
Tinara.
To the deep
deep subtendinous.
subtendinous spaces. Is it connect with superficial one?
No.
Really rare, yeah. Just really rare. In general, it connect with the deep under tendinous spaces. That's why when we have some problem in the pyrgovo-peroneal space, sometime the inflammatory can go here. Remember about this. Okay. Anesthesia, local anesthesia. So, the name of this instrument?
Current set.
Current. Right. Anesthesia.
ഇത് പിടിച്ചാ എന്താണ് there is two anesthesia brown and obvious
Okay. The first one.
like brown anesthesia we will give to the nerves here
Really?
or obvious we will give here
No.
but
It's in Indian, in English, or in Russian.
here we will give it like this
So, the name of this anesthesia.
this is local anesthesia
Which one? No, not really.
obvious
Yes. So, if you start discussing Oberst-Lukashevich anesthesia, what you should do before you make an anesthesia?
we will put a tourniquet
A tourniquet. Put it. You are going to make an anesthesia here. You put a tourniquet here.
here due to for making inflammation or edema
No. You put a tourniquet here.
Okay.
Something like this.
Yes.
And start making
Inflammation.
anesthesia. Yeah? So, for what we put a tourniquet?
to make edema
make an edema.
and we can easily get the nerves
Yeah, so edema just press the nerve and the nerve impulses wouldn't go with so fast, so activity. Oberst-Lukashevich anesthesia, when we have some pyogenic process in the fingers here. Under nails, near the nails, or somewhere here. The main meaning of Oberst-Lukashevich anesthesia is that you start doing an anesthesia here and touch the bone in this position. Touch the bone. After that, you remove the nail, needle, and push it deeper. Push it deeper to this part because other nerves, ulnar nerves, median
nerve,
nerves,
deep.
located deep inside on a palmar area. Okay? Start in this position, after that remove it, and just under the tourniquet, and push it. It's Oberst-Lukashevich anesthesia. We put it with the both side of the finger, with this side and with this side. Okay, here. here we have an example of not really correct, but anesthesia by Brown-Ussoltseva. Brown-Ussoltseva anesthesia, local anesthesia. So we make when we have a pyogenic processes somewhere here and here. So the main idea is that you find a proximal part of metacarpus and put your finger here, just down to the palmar area. Here, here, here. So 3 points, here, here, and here. Proximal part of, not really here, but a little bit upper. Here, here, and here. So this is the correct answer for the question where we make anesthesia by Brown-Ussoltseva. What we use for local anesthesia?
Novocaine, halocaine.
Novocaine. So it's
Halocaine.
a classical anesthetic, but nowadays in a practice we usually use ultracaine, lidocaine, and they are
Novocaine.
the same liquids. So which volume you use for this kind of anesthesia?
Which what?
Volume, volume of liquid.
Like 5% or 10%?
10% volume.
No.
Volume of
Volume.
10 ml of
10 milliliters? A little bit, yeah. So 10 milliliters in each interosseous spaces. And which percent of the Novocaine for this anesthesia?
10%.
Quarter percent. Quarter. 0.20 to 30. Oh, 25, yeah. So quarter percent of Novocaine for this anesthesia, and for this one, half, sometimes 1%. If we talk about subcutaneous anesthesia for incision, for example here, you actually use a 0.5% or sometimes 2% of Novocaine. Here, when you put anesthetic just inside the nerve, near to the nerve branch, yeah? So you use a quarter or maximum 0.5% of anesthetic. Okay? Understand?
And we can't give here anesthesia like for our ulnar nerve or medial nerve.
Actually, if you want to make, and what about the medial nerve? We said that the third part of carpus innervated with medial nerve,
Yes.
and here it's located
Deep.
deep, and it's surrounded with
Muscle.
artery.
Yes.
Radial nerve also located deep inside, and it's
Also with artery.
before the nerve located. Vena cephalica near the nerve located. Radial artery. Is it possible to put anesthesia here? No, not really, because you can damage the artery, you can damage the vein, and they are really big diameter. So, and it brings blood to the whole carpus. That's why it's more useful, it's more common in surgical practice to make anesthesia here. Okay, so I have a question for you. 3 lateral and 4 lateral spaces.
I don't know.
Because it's final lesson for arm. Yeah. Next lesson we start lower extremities. 3 lateral, 4 lateral foramen. Who wants?
Like for quadrilateral forearm.
4 lateral.
What's it? Form here, quadrilateral forearm.
Really?
In this area.
In this area? No, it's subscapular spaces.
Yes, this area.
This is 4 lateral or 3 lateral?
This is trilateral foramen.
No, not really. Look, remember, 4 lateral foramen have in this wall a surgical neck of humerus. Find a surgical neck. So you need to arrange. So first, find the bone. This is the bone. Yes? Surgical neck. You can touch it. You can feel it.
Yes.
Bone. So this is the lateral border of quadrilateral foramen. Put your forceps, put your instrument here. This is 4 lateral. So the border between 3 lateral and quadrilateral foramen is between these spaces.
This
Long head of
biceps.
triceps. So, head of triceps located here. This is the head of triceps. So, it's almost here. Just a moment. Subscapular is here, big head of triceps. And here. So, head of triceps. Here. So, 3 lateral foramen located just here. Just here. So, 4 lateral foramens and 3 lateral foramens here. 3 lateral foramens. Which structures goes through these foramens?
Through quadrilateral foramen, the
Circumflex.
4 lateral.
musculocutaneous
Axillary nerve.
yes.
With which artery?
Radial
Radial artery. A branch of radial artery. And from 3 lateral foramen?
the muscle
Circumflex
of scapula
of scapula.
and infraclavicular.
Infraclavicular. So the main, better say yes. Artery circumflex scapula. Okay, don't forget about it. What else? What interesting things is located here? Can we find also here? So, I think that's all. Okay. Okay, cover the cadaver.